Hey everybody, my name's Chris Steele and this is Investing in Your Health, which is your biggest asset. I want to thank First Community Bank for the opportunity to talk to you guys and Dr. Jeff Angel, who's our expert today. I want to tell you a little bit about Dr. Angel. He has been practicing in Batesville, Arkansas in orthopedic surgery for 20 plus years. He has been a member of the Academy of Orthopedic Surgery, the AAOS, for that whole period in time, and he was appointed to their board of counselors back in 2013, and that's the group of people that really advises them nationally on what to do. Today, Dr. Angel is going to be talking to us a little bit about investing in your health as far as joint health and bone health goes. He's an expert there, and I think now that we're all at home a little bit more, he's going to give us some tips to stay healthy. I know I've heard that some of the cases that you've had on schedule have had to be delayed a little bit, so you've probably got some patients that you know of personally that are having some knee pain or joint pain that may be on the schedule for surgery, but they need that to be delayed a little bit until some of the high acuity problems pass. So with that, is there any recommendations you would give those patients that are at home right now?
Yeah, so there's patients that we're being asked, in all systems across the nation, being asked not to do elective surgeries. And the reasons for that is, number one is we don't want to drain down our protective equipment we talked about. So healthcare providers, there's only a certain amount of healthcare equipment. So if a hospital gets overrun with a lot of COVID patients, we'll need that equipment to protect healthcare workers and to protect patients. And so we're trying to keep the stock of that up high. Another reason is if you're in a high risk group of being over 70 or having a lot of different kind of medical comorbidities or medical conditions that are severe, we don't want those patients coming and getting surgery that could be put off for a month or two during this time. So we've asked patients to maintain at home. So to maintain at home, if you've got something that's really hurting and you think you need your surgery and it's borderline, if it's 30 days that you could stand it, we would ask that you use the things that we consider conservative musculoskeletal health, which is using modalities like heat and ice, doing elevation if the part is swollen, gentle range of motion, try not to stress that joint or that part that is either injured or very arthritic, and also taking good care of yourself with proper sleep, proper nutrition. All of those things will help the body through a difficult time until you can get that surgery that we're putting off for a month, 2 months.
Well, that's some good advice for people who we know need surgery. What about people that don't right now have any problems with their joints or anything? Do you have any recommendations for people who aren't necessarily suffering from joint pain, but they know, hey, I could possibly get it? What are some things to stay healthy that they can?
Yeah, that's a great point, Chris, because even myself, I'm trying to follow these principles, and it's hard because I'm usually more active and going more places, and I'm kind of staying at home more. So we all have to think about our own health, even though we're not getting COVID. That what are the health consequences of being cooped up at home? And so going back to your basics, and that is proper nutrition. I know somebody joked about that they'd gained a lot of weight because they'd eaten up their supply of food at home. And so proper nutrition, try not to overeat when we're maybe pacing the floors or nervous at home or watching the news all the time with all the information that's being blasted at us. Number two is a great way of not only diverting away from nervous eating or snack eating would be to activities. So keeping busy, and the more strenuous that activity, if your health allows, is the better. So doing some exercise during the day, but also if you live in a place that's not in a tight-knit apartment with other people, being able to go outside, do some walking, doing some activities in the yard, it's springtime, so doing some yard activities would be great ways of your health. Finally, like we talked about with the other patient, doing simple modalities, stretching extremities or your knees or your arms, using the over-the-counter medicines like ibuprofen, Tylenol, and Aleve if your provider has told you that those are okay for you, and using common sense on your activities to where you can not overdo it and get an injury during this time. So those are the things to keep healthy at home.
Do any vitamins, any recommendations? Some people are using lots of vitamins or multivitamins. Any recommendations from an orthopedic standpoint on that?
Yeah, so it's It's a controversial area in many areas among surgeons, among medicine doctors, among healthcare professionals, among nutritionists, and so I don't think there's any one way that can say this is the way that you should be doing it. But I personally do take some extra vitamin C. I make sure I take vitamin D since we're not getting as much sunlight on these cloudy days. And also there are other supplements that may be beneficial. We don't have exact proof of it, but a lot of times there's no side effects to them, so why not if you can afford them? So I wouldn't spend all of my money on supplements thinking that they do everything, but at the same time, taking a few of them that you've studied about, I think may be a prudent thing.
That's definitely good advice from that standpoint. So that kind of talks about our joints. What about bone health? I know you have had clinics specifically just on people with weak bones or things like that. Anything specifically to recommend on what to do to keep your bones strong?
So bone health in bones that are unhealthy, usually we're talking about osteoporosis or the softening of bone. And it is just programmed in us when as we age, we lose some of our bone density or the calcium in our bones. Some conditions may cause that to accelerate. Some medicines may cause it to accelerate, like if you're on steroids, or some of the neurological medicines for seizures can cause bone loss. So if you're at high risk for either in age or in taking medications, we would recommend that you supplement vitamin D and calcium. Also, for other people who aren't at high risk, we recommend that a nutritional diet with well-balanced diet, have all the food groups and to get the nutrients you need. Also, if you're not getting sunlight, and most Americans, it's been shown, have periods of time where they're low on vitamin D. So a vitamin D supplement is recommended for most people. Also, we'd recommend activity. There's actually a thing called Wolff's Law, which means bone responds to pressure and activity. So the more you walk, the more you lift weights, the more you do things, the sturdier your bones are because they actually attract calcium as pressure is put on them. So the activities is important in decreasing osteoporosis. And finally, the things that can cause osteoporosis as well is smoking. So we advise stopping smoking, exercising, good nutrition. Those are the main things we can do to keep our bones good and strong.
With that, I want to thank everybody for joining us. We want to encourage you guys to correspond with us when possible. Send us emails, give us a call. We want to hear your feedback. We want to thank you again, Dr. Angel, for your time with us today. And also want to thank First Community Bank. And again, for everybody, I want to thank you for choosing to take time to invest in your health. Have a great day.